needle. They can spot this without doing an MRI or anything. But if it's spotty, diffuse injury of the brain, like you get in repeat concussions or repeat head traumas, or when you get to a virus type injury, you can spend all your life hammering on the toes and knees and the various points, checking and doing an absolutely great neurological assessment. You find nothing. You have to go in with modern technology, and the best is SPECT and PET. Unfortunately, we don't have a single PET scanner in Canada which is set up, to my knowledge, for brain interpretation. For cancer, yes. For heart, yes. But none of our PETs have the software for brain.
So we were speaking earlier about thermography, and that technology was actually developed for the military, where they were trying to spy on their neighbors and they would look at the heat thermal scans. But we can now use this technology for our bodies. And how does this apply to fibromyalgia? I think we have some pictures that we could show on the screen as well.
Yeah, these are fun.
Yeah.
I'll tell you what I do. They're on the second floor of the museum downtown off of Elgin Street, the Science Museum. Is that the science? That's not the science. That's the biology museum.
That's a Museum of Nature.
Yeah, Museum of Nature. Yeah. On the second floor, there's a thermogram. And so I send my patients down and I said, you know, what you do is you put a T-shirt on and take electronic camera with you and quick whip off your shirt and get a photograph, and then you take a photograph of the person who's fine.
Yeah.
And the difference is enormous, and you can actually see it in these thermograms.
So what are we seeing? We're seeing
what you're seeing is shut down. The young girl here, there's actually no blood going to her hands, her fingers, whereas the father, who actually has a form of rheumatoid arthritis, so he's not a real good subject because he's got more blood going to the extremities in his case. But look at the girl, literally no circulation, and this is painful.
Right, okay.
Yeah, there's almost no blood going to most of her arms. Again, this is painful. She's got a watch on, and so that's where you get that.
Well, your work is groundbreaking because I know that one of the issues, and Dr. Watson, you know this, anybody with a disability trying to get disability insurance, it's very difficult, correct? Like they really have to prove everything, and they want lots of clinical information. I'm sure you write pages and pages for people.
Well, absolutely. You know, it's hard to make that diagnosis of fibromyalgia.
Exactly.
And you know, that's really, I guess, where Dr. Hyde comes in, because we had talked about that before.
So if we are trying to help somebody who has fibromyalgia, because the insurance companies want clinical information, what clinical information can we help provide?
Can I do a sachet on that?
Yes.
You've raised perhaps the most important position of all. Physicians are paid for minor assessment, intermediate assessment, and one major assessment a year. Nobody is paid for a complete investigation.
This is true.
And so for me to do a complete investigation, my first office visit tends to be a day and a half.
Wow.
It takes me that long to take the history of the patient, his parents, her parents, grandparents, aunts, uncles. And this is really important because a lot of the reason people don't get disability insurance, nobody's taken their history. And that already sets you up for about 25% of the diagnoses.
Sure.
And then I do step by step a complete investigation, like when I was looking for gold mines and copper mines in the Arctic. And we check every organ using technological equipment like SPECT scans, like MRIs and PETs. But there's a whole range of these type of instruments. Doctors just aren't paid to use this technology because they're not paid to write out the extensive requests. They're not paid to read it. And so in a way, a lot of these patients with disability insurance problems are they're not investigated properly by their physicians. And it's not the physician's fault.
No, it's the system, the
it's
way
the
that
system,
it's organized, yeah.
which really helps the insurance companies.
It's true, because if we're asked to do a report, we're asked just on our one little piece of the pie of that person's health. And although we've spent a lot of time with them, we don't all meet for that individual and say, I found this, and let's put it all together, which would really be what we should be doing, more collaborative.
But I have to tell you, to do what I do, I can see a maximum of about 15 patients a year. It takes me 6 months to investigate these, so there's no money in it. But it's absolutely fascinating, the disease we find, and we win almost every insurance case.
That's fantastic to hear, because there's a lot of myths about fibromyalgia, and one of them is that it's not curable. What would your comment be about that?
Find out the causes, and if it's a medication that's causing it, remove them. I was speaking to Dr. Watson a few minutes ago, and one of the first things I do with all of these patients is do a complete investigation for rheumatoid disease. And normally what doctors do is they do ANA, anti-nuclear antibody, and if that's normal, they say, well, it's not a rheumatoid disease. There's over 15 rheumatological tests that I know of, and some of them are positive and some are not. And so that's one way to go. But one of the things that Dr. Watson and I were talking about is HLA-B27 and HLA-B60, which is a gene which causes the entire spine to become one solid mass, or parts of the spine to become one solid mass. And this is exceedingly painful, very limiting. Well, if you do an HLA-B27 on a lot of these patients, they're positive. Now the spine is quite normal, but this is early on in the game. And one of the things I suggested to Dr. Watson, any of these patients, do a complete spinal x-ray, because about 25% of them already have all sorts of arthritic changes in their spine going from the neck all the way, and this is the cause of their fibromyalgia. So from an insurance point of view, that is exceedingly helpful.
We want to make sure that we highlight your books as well, because you definitely are an expert in the field. So we have this one. Can you tell us about this quickly? We have just a minute left.
That's an inexpensive book. You can get it online. The best way to get it is just going onto the internet for misdiagnosis, and it's not expensive. I think it's about $15 or $20. But it will outline some of the things we've discussed here today and a lot more.
And there's more, but I think we're really recommending that we have our...
Yeah, the big book is free online.
Okay, so this is
But it's huge.
book.
To download that, it will break your printer.
Thank you, gentlemen. It's been a pleasure to have you here. You're both experts, and we really appreciate your input. So if anybody does have fibromyalgia, you can contact Dr. Hyde or Dr. Watson. And the Nightingale Foundation is really a gem here in Ottawa. As you can hear, there's so much to learn, and we appreciate your time. So thank you for joining us today, and don't forget to watch us next time. You can also hear me June 16th. I'm going to be speaking about hormones at National Capital Fit Day. Thanks, and have a great day.